Good afternoon. My name is Faridah, an emergency medical technician. Today I'm concerned with COVID-19 in pregnant women. We are going to discuss about this pandemic on our pregnant women today. There's not much data concerning this pandemic on pregnant women, but they should always be cautious, they should always be vigilant, and they should not panic. The pandemic, for sure, it has really made many people to get scared. But I'll urge all pregnant women, go to the clinic for your antenatal checkup. Do not miss. Unless you are not feeling well that much, you can call your doctor. The signs and symptoms for COVID-19, if you have temperature above 38 degrees centigrade, if you have respiratory distress, and another thing, if you have flu, you feel that this flu is not going out, it is too much, the temperatures, the fevers are high, you're coughing, please report this to the nearest hospital so that they may be able to take samples, go for isolation if for sure the signs and the symptoms are that much. When you're in isolation, pregnant women, there are tips how to navigate through pregnancy. You will avoid close contact with people who have been affected. Wear a mask when you're moving out of the house. And another thing, have rest and do not take much rest, because when you sleep a lot or you take much rest, you will find that you can develop thrombus or thrombosis, the DVT. So you should avoid sleeping too much. Just have rest a little bit for you to avoid having thrombus, as I've just said. Another thing, ensure that when you're out, you've gone to either supermarket, church, where public members are very many. Try to avoid you mingling with them that much. It will help you not to get infection. I will urge pregnant women also to take care of themselves while taking a lot of fluid and eating a balanced diet. They should ensure that all the meals they are taking is all balanced. Another thing for our pregnant women, what they're supposed to do, they should maintain hygiene. They should wash their hands with soap for more than 20 seconds. And I'll prefer them also to have thermometers in the house. I think this one will help them. Ensure that your thermometer is working. It should not when you feel fever or you feel like your body temperature, it's not normal, use the thermometer to get your vital. If it exceeds 38, seek medical advice. You should also sanitize. Ensure you sanitize well when you're from doing any chores. You've contacted some items, always ensure you sanitize. That's why I've said maintain hygiene. For them, they should avoid to touch their face, touch their nose, and touch their eyes. Avoid touching your mouth too, because this infection is virus or it's viral. You can spread it in your respiratory system very fast. So I urge all pregnant women to really take good care of themselves, because this is the only thing that will help also your baby to be healthy. When a pregnant woman or pregnant women are healthy, their children also will be healthy, or their babies will be healthy. When you've realized that you have these symptoms, stay at home. Do not move to different places, because you will infect others outside there. stay at home. Call your gynecologist. You can tell your gynecologist what you've experienced and the signs and symptoms that you're having. I think your doc will give you what you're supposed to do, or he will guide you what you're supposed to do. Another thing, you should also have social distance, which is 1.5 meters. And also the surfaces that you're touching, please, can you disinfect them? Disinfect them and also clean all the objects that you put your hands on. What to do when you know you're infected? Drink a lot of warm water. Take fruits that have citric acid. You can also gargle betadine solution, add with some little water. It also helps your trachea when you gargle betadine solution. Mix it in a good proportion with water. Take food that has garlic and ginger. Those are the things that will help you to prevent getting COVID-19 or getting this viral infection or SARS. I will invite one of my colleagues. I want us to demonstrate when a pregnant mother is having these signs and symptoms, what they are supposed to do when they're in the house. Please, you're welcome. Here we have 2 types of BP machines that you're supposed to have in your house. We have a digital blood pressure monitor, and then we have this one. It's called a wrist. This one is also called a wrist BP monitor machine. We will start with the wrist BP monitor machine. I think this one will be easier because you just put it on your wrist, just as watch, and then you take your vital signs, or you take your BP or blood pressure, and then you read, and you can write it somewhere or record it somewhere. Then when you call your gynecologist or your doctor or medical care person, you give the reading. Okay, how are you?
I'm fine.
You're fine. How is your health today?
I'm doing good.
You're doing good? Okay, today we are going to to do some vital signs. We are going to take temperature. We are going to take your BP, and we are also going to take SpO2s. This one we are going also to check oxygen saturation in her body system. That will help us. You know, very many people, when they get sick of COVID or suspected patients who have pneumonia, when they are taken to hospital, you find that their oxygen levels also goes down. So I've brought everything on the table for us to learn today what you're supposed to do at home, or the signs and symptoms that will have gotten them at home before you call your doctor. Okay. First of all, you have to maintain what is called BSI. Yes. With BSI, you're supposed to put on your gloves. Ensure that it's safe for you to do this. I am putting on gloves because I am taking care of her. But if you're alone in the house, you can do it yourself minus gloves. Okay. What's your name?
My name is Aisha.
You're Aisha.
Yes.
Okay, Aisha, today, don't panic, just relax. Yes, and then, if you panic, your BP might go very high, and maybe you're a person who has a normal BP. Sawa sawa?
Yes.
Okay. So we will take it. We'll use this. Supposed to put it like this. This is systolic. Let it face you like this when you're alone in the house. Put it on as a watch. And then we are going to put it on. And then now we will wait. As we are waiting for her BP to continue reading, ensure that when you're taking your BP and you're in the house and you've gotten these symptoms, ensure that you breathe in and out. Do not panic. If you panic, you will find everything going abnormal. Yeah, because wewe mwenyewe uko na wasiwasi ndani ya moyo wako. So relax, calm down, then you get your BP in place. So for her, we've already gotten the readings. I will leave the readings with her, but her readings are very normal. She will look at them. You should have a systolic of mostly for pregnant women 125, 135 there, because she's having another fetus with her. And your systolic should not be less than 80, and your diastolic should not be more than 90, because that one will be dangerous to your health and to our baby. So I've told you this is a wrist BP machine. So at the same time, we will do our digital blood pressure monitor. The digital blood pressure monitor, this one you will need another person. So you cannot do it alone in the house. I can do it alone because maybe I'm used to, but you find when you're in the house alone, maybe if you don't have the wrist one, because the wrist one is simple, get someone, teach that person on how to put it on, and also get your BPs in place. So Aisha, today we are going to use this one again to take your BP. I want you to relax, yes. Okay, when you relax, you put it on. Atakata. I want it to be here. Yes, here. Church, yeah. But let me just say, okay. Also, the blood monitor is also normal. So, as I've told you, we are working with two of the BP machines. Okay. This one is called SpO2. It measures the concentration of oxygen in your body. It should not be less than 96%. Normal SpO2s in our body or oxygen saturation should be 100%, 96 to 100. So lesser than that, you're supposed to be either given oxygen or supplemented with oxygen using a nasal cannula or an rebreather, or can be used, you can also be given through vent, and some also through BVM. So Aisha, I'm going to take your oxygen. And another thing, your nails, when you're taking your oxygen saturation, please ensure that your nails do not have coloration. What do we call them? Cutex. Yes, you should not have cutex when you're taking this, for it to give you better reading. And when you put it in your finger, ensure that it really fits well in your finger, and then you put it on. I want to get your SpO2s, the oxygen level in your blood system or your body system, that can make you to survive for. And also, it also gives us a heart rate. You should not have a heart rate more than 30. Normal for adults, it's 16 to 20. Some goes to 22, 23. You should not be above 30. Your heart rate. This is your heart rate. This is your oxygen level. That is doing well, but we will still continue waiting because we need it to be. Yeah, so you really have great oxygen levels in her body. So for Aisha today, sanitize. Yes, and you should also ensure that after using your equipment, sanitize them. And I've already told you about the thermometer. For thermometer, this one is for home use mostly. Use it at home, and some of us use thermogun to get the temperature of a patient. So if you're at home, use all this. Don't panic. Eat well. Yeah. For today, we are done with COVID-19 for pregnant women. If you have any question, please don't hesitate to contact farikavere@gmail.com. It is down there. You can ask any question so that we may be able to answer. Do you have any question?
No, I'm okay.
You're okay?
Yes.
Sawa. So don't hesitate, don't have panic. If you have all these symptoms, just stay at home, avoid close contact, wash your hands for 20 seconds. Those are the things I'll advise. Thank you so much.